Chronic obstructive pulmonary disease, COPD, is a progressive disease caused mainly by smoking. The symptom-based diagnosis is mainly based on the presence of chronic productive cough and dyspnea, that is, a sense of increased difficulty in breathing. A diagnosis of COPD is more probable if, along with these symptoms, the subject is exposed to risk factors such as smoke, powders or chemical substances in the workplace, outdoor or environmental pollution, and indoor pollution. The key points in the management of these patients consist of early diagnosis, smoking cessation, and pharmacological and rehabilitation therapy. The diagnosis is based on spirometry, which measures breathing ability. COPD is characterized by a reduction of flow in the airways, revealed by a decrease in FEV1, or forced expiratory volume, in 1 second compared with vital capacity. The lower this value, the more serious the illness. An evaluation of the reversibility of the airway obstruction makes it possible to distinguish asthma from COPD. COPD is characterized by a progressive obstruction which shows little reversibility, while asthma displays a variable and reversible obstruction. Often the spirometry, when it indicates the presence of bronchial obstruction, motivates the patient to quit smoking. The second key point in the medical treatment is smoking cessation, which is the most effective and cost-effective intervention to reduce the risk and arrest the progression of COPD. Sometimes, a simple interview with a doctor can help a patient quit smoking. Some drug treatments have also been proven effective, such as the use of bupropion SR and the use of nicotine administered via inhalation, via patch, or chewing gum. The third key aspect of management is pharmacological treatment of a COPD, suggested both to improve symptoms and reduce complications, or to treat the disease exacerbations that may occur. Once drug treatment is started, it should be continued regularly and adjusted according to the clinical situation. The most important drugs for symptomatic treatments are inhaled bronchodilators. These agents, depending on the severity of the COPD, can be prescribed either as needed or on a regular schedule. In some patients, inhaled corticosteroids are given. When there is a sharp increase in sputum production or dyspnea, it may be necessary to take corticosteroids or antibiotics either orally or by injection. And, if there is moderate to severe respiratory distress, hospitalization may be required to perform an arterial blood gas analysis and an adequate treatment. The first thing to do when the COPD patient arrives in the emergency room is to administer controlled oxygen therapy and determine whether the patient's condition is life-threatening. If it is, the patient must be admitted directly to intensive care and, if necessary, go under airways intubation and semi-intensive therapy for a non-invasive ventilation. In other cases, regular hospital or outpatient management may be sufficient. There are also treatments that can improve the patient's function or prolong life. These include pulmonary rehabilitation and oxygen therapy. The main objectives of respiratory rehabilitation are to improve symptoms and quality of life, and to increase the patient's physical and psychological participation in their daily life. The program, consisting of exercise, dietary advice, and education,